Welcome to my channel. In this video, we are going to learn about internal features of medulla oblongata. Before watching this video, I request you to watch my video on tracts of spinal cord for better understanding. Internal structure of the medulla can be studied by examining the transverse section of medulla at three levels. At the level of pyramidal decussation, at the level of sensory decussation, at the level of olives. Now let's see the transverse section of medulla at the level of pyramidal decussation. The section at this level passes through inferior half of the medulla and it closely resembles to that of spinal cord. Gray matter. Regarding gray matter, remember four things. Detached anterior horn, central gray matter with central canal, nucleus gracilis and nucleus cuneatus, nucleus of spinal tract of trigeminal nerve. Detached anterior horn. Decussating pyramidal fibers separate the anterior horn from the central gray matter. The separated anterior horn laterally it forms spinal nucleus of accessory nerve. Medially it forms supraspinal nucleus for first cervical nerve. Central gray matter with central canal is pushed backwards. Central gray matter with central canal is pushed backwards. Nucleus gracilis and nucleus cuneatus are continuous with central gray matter. They appear as narrow strip-like projections from the posterior aspect of the central gray matter. You can see they appear as narrow strip-like projections from the posterior aspect of the central gray matter. Apex of posterior horn gets swollen up to form nucleus of spinal tract of trigeminal nerve. Apex of posterior horn gets swollen up to form nucleus of spinal tract of trigeminal nerve. Now let's see in brief about spinal nucleus. This is sensory nucleus of trigeminal nerve, motor nucleus of trigeminal nerve. Motor and sensory nucleus of trigeminal nerve are present in pons. Motor nucleus and sensory nucleus are present in the pons. Spinal nucleus extends from sensory nucleus, which is present in pons, to C2 spinal segment. Hence, the spinal nucleus passes through the medulla oblongata. Spinal nucleus extending from the sensory nucleus, which is in pons, to the C2 spinal segment. Hence, it passes through medulla oblongata. When we take the cut section of medulla oblongata, we can see the spinal nucleus. These descending fibers present beside the spinal nucleus are called spinal tract of trigeminal nerve. Spinal tract of trigeminal nerve is also present in medulla oblongata. White matter. Regarding white matter, remember the pyramids present anteriorly, decussation of pyramidal tracts in the lateral white column, lateral corticospinal tract, lateral spinothalamic tract, spinocerebellar tracts. In the posterior white column, fasciculus gracilis, fasciculus cuneatus, and reticular formation. Pyramids present anteriorly. Decussation of pyramidal tracts forms the most important feature of medulla at this level. About 75% of the pyramidal fibers runs backwards and laterally to reach opposite lateral white column. They continue down as lateral corticospinal tract. Fasciculus gracilis and fasciculus cuneatus occupies the broad posterior white column. Reticular formation, it consists of many interconnected neurons. It is present throughout the brainstem. In the lateral white column, spinocerebellar tracts and lateral spinothalamic tract is present. Spinal tract of trigeminal nerve caps over spinal nucleus. Spinal tract of trigeminal nerve caps over nucleus of spinal tract of trigeminal nerve. Gray matter, detached anterior horn, central gray matter with central canal, nucleus gracilis, nucleus cuneatus, nucleus of spinal tract of trigeminal nerve. White matter, pyramids, pyramidal dexation, reticular formation, lateral corticospinal tract, lateral spinothalamic tract, spinocerebellar tracts, fasciculus gracilis, fasciculus cuneatus, spinal tract of trigeminal nerve. Now let's see transverse section of medulla at the level of sensory dexation. Just observe the gray matter, nucleus gracilis, nucleus cuneatus, accessory cuneate nucleus, spinal nucleus or nucleus of spinal tract of trigeminal nerve, central gray matter, inferior alveolar nucleus. Nucleus gracilis and nucleus cuneatus become more pronounced and are separated from the central gray matter. You can see the nucleus gracilis, nucleus cuneatus separated from the central gray matter. Lateral to nucleus cuneatus, accessory cuneate nucleus is present. Nucleus cuneatus, lateral to nucleus cuneatus, accessory cuneate nucleus is present. Accessory cuneate nucleus relays unconscious proprioceptive fibers from the upper limbs. Nucleus of spinal tract of trigeminal nerve is also separated from the central gray matter. Lower part of inferior alveolar nucleus is seen. Central gray matter. It consists of following nuclei. Nucleus of tractus solitarius, dorsal nucleus of vagus, hypoglossal nucleus. You can see the hypoglossal nucleus. It is present close to the midline. It lies in ventromedial position. These are pyramids. This is ventral side, dorsal side. Dorsal nucleus of vagus lies dorsolateral to hypoglossal nucleus. Nucleus of tractus solitarius lies dorsolateral to dorsal nucleus of vagus. Now let's see white matter. Nucleus gracilis and nucleus cuneatus gives rise to internal arcuate fibers. Nucleus gracilis, nucleus cuneatus gives rise to internal arcuate fibers. These fibers crosses the midline and reaches the opposite side where they form a paramedian band of fibers called medial lemniscus. These fibers crosses the midline and reaches the opposite side where they form a paramedian band of fibers called medial lemniscus. Pyramidal tracts lie anteriorly. Medial lemniscus, anterior to medial lemniscus, pyramids. Posterior to medial lemniscus, medial longitudinal bundle. Spinocerebellar tracts, lateral spinothalamic tract are present in the lateral white column. Gray matter, nucleus gracilis, nucleus cuneatus, accessory cuneate nucleus, nucleus of spinal tract of trigeminal nerve, central gray matter consisting of nucleus tractus solitarius, dorsal nucleus of vagus, hypoglossal nucleus, inferior alveolar nucleus. White matter, internal arcuate fibers, medial longitudinal bundle, medial lemniscus, pyramids, reticular formation, spinocerebellar tracts, lateral spinothalamic tract in the lateral white column. Now let's see the transverse section of medulla at the level of olives. Gray matter. Nuclei of several cranial nerves are seen in the floor of fourth ventricle. Pyramids are present anteriorly. This is ventral side. This is dorsal side. Hypoglossal nucleus lies in a paramedian position. Dorsal nucleus of vagus lies lateral to hypoglossal nucleus. Nucleus of tractus solitarius lies ventrolateral to dorsal nucleus of vagus. It lies lateral to dorsal nucleus of vagus. It lies ventral to dorsal nucleus of vagus. Medial and inferior vestibular nuclei lie lateral to nucleus of tractus solitarius. They lie medial to inferior cerebellar peduncle. Spinal nucleus and spinal tract of trigeminal nerve lies Ventral to vestibular nuclei. Nucleus ambiguous lies deep in the reticular formation. It lies ventromedial to spinal nucleus and spinal tract of trigeminal nerve. Arcuate nucleus. It is present anteromedial to pyramidal tract. Inferior alveolar nucleus. It is the largest mass of gray matter and it forms most prominent feature in the section of the upper part of the medulla. When we take the section of upper part of medulla, inferior alveolar nucleus is the most important feature. It presents a crumpled bag-like appearance. Close to the main nucleus, medial and dorsal accessory alveolar nucleus are present. Close to the main nucleus, medial and dorsal accessory alveolar nuclei are present. White matter on either side of the midline in the paramedian region from dorsal to ventral. From dorsal to ventral, medial longitudinal bundle, tectospinal tract, medial lemniscus, pyramidal tract are present. Inferior cerebellar peduncle occupies posterolateral part. Inferior cerebellar peduncle occupies posterolateral part. Let us now revise the internal feature of the medulla. Transverse section of the medulla at the level of pyramidal decussation. Gray matter, white matter. Regarding gray matter, remember four things: detached anterior horn, central gray matter, nucleus gracilis, nucleus cuneatus, nucleus of spinal tract of trigeminal nerve. Central gray matter with central canal is pushed backwards. Nucleus gracilis, nucleus cuneatus are continuous with the posterior aspect of the central gray matter. The apex of the posterior horn gets swollen up to form nucleus of spinal tract of trigeminal nerve. Reticular formation is present. White matter, pyramids present anteriorly, pyramidal decussation seen at this level. 75% of the pyramidal fibers runs backwards and laterally to reach the opposite lateral white column to continue down as lateral corticospinal tract. In the lateral white column, spinocerebellar tracts, lateral spinothalamic tract are present. In the posterior white column, fasciculus gracilis, fasciculus cuneatus are present. Transverse section of the medulla at the level of sensory decussation. Gray matter. Nucleus gracilis, nucleus cuneatus, accessory cuneate nucleus, spinal nucleus, central gray matter. It contains nucleus of tractus solitarius, dorsal nucleus of vagus, hypoglossal nucleus, inferior alveolar nucleus lower part. White matter, nucleus gracilis, nucleus cuneatus forms internal arcuate fibers. These fibers crosses the midline and reaches the opposite side. They form medial lemniscus. Medial longitudinal bundle lies dorsal to medial lemniscus. Pyramidal tract lies anteriorly. Spinocerebellar tracts, lateral spinothalamic tracts lie in the lateral white column. Reticular formation is present. Medial and inferior vestibular nuclei, spinal nucleus, nucleus ambiguous, inferior alveolar nucleus, dorsal axillary alveolar nucleus, medial axillary alveolar nucleus, arcuate nucleus. White matter in the paramedian position from dorsal to ventral, medial longitudinal bundle, tectospinal tract, medial lemniscus, pyramidal tract. In the lateral white column, you can see the spinal lemniscus, spinocerebellar tract, inferior cerebellar peduncle. Inferior cerebellar peduncle lies posterolaterally.